Good morning, everybody. Gonna do some stretching this morning. Welcome to Dr. Schafer's Stretching Sunday class. Today, we're gonna try to get in as many stretches as possible, about 40 minutes, 45 minutes long. Things you'll need today. Before I start, this class is basically the same. With the core classes, I'm starting to rank them for beginners, intermediate, advanced. For stretching, there's no such classification, just for clarification, because the variations I'll be showing you should be able to apply to just about anybody in the population. If you feel like you can't do the stretch or the variation that we show you, do drop me a message and let me know what the problem is exactly, because I'd be very interested in figuring out what that problem is. But so the things we're going to need for today's class, a yoga mat is helpful. I'm not using one. It's easier to see what I'm doing without one. Carpeted floor works pretty well. A textbook. And we'll show you what that's being used for later. Maybe about an inch and a half thick. Phone book works pretty well too. 2x4, not as thick really. 4x4 is probably too thick. So if you got chunks of wood laying around, that might work, but it's not readily, a size available. And then a strap, a rope, dog leash, clothesline, whatever you got laying around that you can just pull things with. I'm going to say don't use an elastic band because it has give, so you'll get less of a pull. So elastic bands certainly have their use, but we're not going to be using them. And a chair. If you could have a chair nearby, for a couple of these stretches, they are necessary. For a couple of them, they are helpful. So we're going to start off like we usually do with the up dog, and I've gone to doing alternating up dog with child's pose. So, before we start, for today's class, I want to try to get in a lot of different stretches. So, what I'd like to do is, instead of doing the 3-breath method five times, I'm going to do the 5-breath method 3 times. Maybe we can squeeze in a few more exercises by doing it that way. So, up dog, I also call it the lazy push-up. Make sure your shoulders are being pushed down and they're not creeping up to your ears. Take 5 breaths. 1, 2, 3, 4, 5. And then child's pose. Make sure your knees are apart. Your big toes are touching. This is Dr. Schafer's version. This is not necessarily the same as the yoga version. Get your butt down first, and then drop your arms, your head, and then reach your arms out. Take 5 breaths. 1, 2, 3, 4, 5. Bringing the knees apart is helpful in as much as you'll feel a little bit more stretch in the hips. You will feel it in the low back as well, but I find it to be a much more effective stretch by stretching out the hips a little bit more. When going back into the up dog, make sure you're doing a couple things and continue to breathe the 5 breaths, and I'll keep talking. Try to make sure you're looking straight forward. Try to make sure that your ears are high and they're not coming down towards your shoulders. And make sure that you're stretching out your elbows and straightening your elbows, as long as you don't have any wrist or hand problems. That shouldn't be an issue. All right, we'll call that 5 breaths. Go back into the child's pose, butt down first, then head down, and then arms out. The adjustment I made there is I brought my knees apart a little bit more because it felt like my hips could sink down a little bit more if I did so. 1, 2. People ask where their pelvis should be on this one, and I say don't worry about it. Your hips don't have to touch the floor. In fact, for few people that actually do they. It's not bad form to have your pelvis lifted. That's just let it drop where it goes, and that's where it's going to be. Don't think about it has to be in any certain angle. People sometimes tend to overthink it. Child's pose. 1, 2, 3, 4, 5. Good. Why am I counting breaths? Mostly to make sure that you guys are breathing. I've been to enough yoga classes to know that half the class, even though the instructor is saying breathe at the top of their lungs, half the class is still holding their breath because I can see it in their face. Okay, wall side bend is next. Get near a wall, a door. You can do this freestanding as well, it's not as good. The wall helps guide us into a position that keeps us in one singular plane. So what I mean by that is we're just going to bend to one side, take 5 breaths. Excuse me. Your body will lie to you on this one. What I mean is, for many people, I find that they go to there, and I say, that seems a little stiff. Are you sure that's as far as you can go? And then they go, oh yeah, I guess I didn't realize I was holding back a little bit there. Now, if it is painful, I want you to think about something. I want you to try to think about not avoiding pain entirely. I'm not saying this should or shouldn't be painful, but for a fair number of people, they'll feel a little bit of pain in the hip because it's stretching. So think about wading into the waters of pain instead of jumping in head first. What we're really trying to do is, well, we're trying to stretch these muscles, but we're also trying to get your body used to being in these positions and saying to your body, hey, it's okay to be in this position. It's not going to harm anything. And then teach the body to try to relax into that position. I don't know if you can tell on the video, but this side feels stiffer to me. Like I can't go as far. Ideally, you'd be able to get your head to be about horizontal to the, and if you're not sure where you are, just think about trying to listen to the ceiling. That kind of gives you the idea of where your head should be at. I'm doing this up against the wall as your head and upper back should be close to or touching the wall. What happens with too many people is that the shoulder tends to drop forward, and then you're adding the element of rotation instead of staying into this plane of side bending, technically lateral flexion. 1, 2, 3, 4, 5. I think for the stretches, we're going to stick with the 5 breath method going forward. I think it's a little bit more efficient. I could probably get more done. Torso rotation. So, making sure you can see this on the video, looks good. What we're going to do is lay you down on your back. There's 2 variations. The easy variation, I want you to bend up both knees, pick up one leg, a little bit higher than the other. If it's your right leg, drop both legs down to the left. Take 5 breaths. Try to see if you can see that on the video. I think you can. Keep your arms nice and wide. This will help get you a little bit of rotation into that torso. Most of you are probably feeling a little bit in your hips. We'll call that 5 breaths. Plant both feet again, knees up again, knees bent. Lift up the left leg. Drop both legs down to the right. So you can see I'm a little stiff. My foot doesn't go down all the way, and that's all right. 2, 3, 4, 5. Okay, leg up again. Right leg up, drop them both down to the left. 5 breaths. 1, 2, 3, 4, 5. Good. Some of you are probably thinking to yourself, wow, that's a great stretch. Some of you are probably thinking to yourself, wow, I don't feel this at all. 2, 3. So if you are the second type of person where you don't feel much, I want you to do this next variation. If you feel it and you feel like it's a good stretch, continue to do one more. If it feels too easy, lift up both legs, drop them both down to one side. Take 5 breaths there. 1, 2, 3, 4, 5. Good. Lift and twist to the other side, slow and controlled, no flopping. 1, 2, 3, 4, 5. We're going to do one more time on each side because I feel like this is an important one. 1, 2, 3, 4, 5. Slow and controlled. 1, 2, 3, 4, 5. Good. All right, moving along. Let's see what we got next on the cheat sheet here. We're going to use your textbook. Oh, that's my textbook. If you are a patient of mine and you have one of these little foam pieces, go ahead and use that instead. We're going to use it to stretch out the calves. Now I want you to stretch out the calves a very specific way. This is actually more of a foot supination stretch. People sometimes are stuck in pronation. That's what they call overpronating. So if this feels like you, this is a great stretch for you. Put the textbook or foam piece down. I want you to bend that knee. That's important. Bend the knee first. Then push the knee to the outside. I'm not going to bother counting on this one, counting breaths. This doesn't challenge your core muscles as much as some of my exercises. So I'm not even going to give it a number. Point your knee forward. Push the knee to the outside. Point the knee forward. Push the knee to the outside. You don't want to necessarily push the knee to the inside. Most of the time, feet will readily go into pronation. Sometimes our feet are so stiff and they haven't gone into supination for so long, they've forgotten how. Other foot, you're going to put the forefoot on the textbook or the foam piece, keep the heel on the floor. Point the knee first, then push the knee to the outside. If you notice, I am not twisting my whole body. I am just pushing the knee. Knee forward, knee out. Knee forward, knee out. Since we have this foam piece or textbook down, we're going to do one more. This one is going to be the straight knee calf stretch. Gastrocnemius crosses the back of the knee. This is the big, thick calf muscle. Some people have a ball popping out right there. That's the gastrocnemius. Keep the knees straight in order to get a good stretch on this one. I want you to lean your whole body over the textbook or over the foam piece. If you notice, my other foot's actually in front of it. So keeping the knees straight, gently bring your whole body forward. Hips included, so not here, but here. Go ahead and try the other one. Like I said, I'm not going to give a number on this one. I'm not going to do the breathing thing on this one. Keep the knees straight first. Let's call it, keep the knee straight first. Heel down. Take a step forward, over the book, over the foam piece. Continue to keep the knee straight. If you're not consciously thinking about keeping that knee straight, I guarantee you that knee will bend. Other side again. If you feel like you're not feeling anything, it's possible it's just not a tight muscle on you, though I kind of doubt it. Try a couple things. Try shoving your hips forward more and continue to keep the knee straight. That will usually bring out, that light bulb will go on and you'll say, oh, that's the right angle. Switch feet, heel on the floor, forefoot on the foam piece or textbook, knees straight, step forward. You can tell my right calf is a little tighter than my left. I'm having a hard time finding the right angle for it. These stretches, for about half of my patients with plantar fasciitis, these two stretches alone take care of the plantar fasciitis. For the other half of the patients, the plantar fasciitis is actually a weakness in one or more of the calf muscles and foot muscles. And so actually strengthening them is where a lot of people, it's not something a lot of physical therapists would think to do. Most physical therapists and other chiropractors have a specific exercise regimen for whatever condition. So for plantar fasciitis, oh, here you go, here are my plantar fasciitis exercises, and that happens to be mostly stretches. I find it's more helpful to see what's tight, what's short, what muscles may be weak, and act accordingly. If you have short calf and foot muscles, absolutely, stretching them is going to help. But if they're not short, let's say they're weak instead, you can stretch all day long. You're never really going to get the results that you want. Hip flexor stretch with, okay, so I want you to try this without a strap first, but this is the one where you might need the strap. So use the chair or a wall, whatever you got nearby, and this is your basic quadriceps stretch. But with the quadriceps stretch, what I really want to achieve is some hip flexor stretching. So I want you to try to bring the knee back more without bringing your head and chest forward. So I'll do it again. It's a slight difference, but it makes all the difference in the world in regards to actually stretching your hip flexors. I found the only way to really stretch the hip flexors is to get a good stretch on the quadriceps first, and then stretch the hip flexors. So, knee bent, knee back. I'll show you from the front. You keep holding and breathing. Knee bent. You'll notice that this knee is actually close to this knee. So if you find yourself way out here, try to bring it down and close first, and then bring the knee back. Yeah, you're probably feeling it there. Back to the first side, left foot. This one we're gonna call it about 5 breaths, but I'm gonna keep talking. Hopefully you're not holding your breath. Once again, your body will lie to you and say, oh, there we go. My knee is now behind the other one. Well, that's because you leaned your whole body forward. Rather than do that, you want to push that knee back. Takes a little bit of muscular control, and I highly recommend using something, holding on something for balance. It's not about balancing. Some people like to brag about how good their balance is and do this without balancing, and it's not that hard. But I don't want it to be about balance. I want it to be about stretching. Okie dokie. That was 3 times on each side. Moving forward, we're going to get out the chair. Oh, I didn't show you the variation. I apologize. I'm going to go through that now. Because if you were unable to do that one, you were probably just twiddling your thumbs throughout that whole spiel. So for this one, take your rope, take your strap, lay down on your side, get that rope or strap around your foot. Go ahead and lay down all the way. Then drag that rope or strap to the ankle and then pull it towards you. I'll have to be honest, I don't feel much here. But I'll go through this with you in case you were not able to do the first variation on this one, because this is an important stretch. And I find it to be one of the most commonly tight and short muscles. Now, honestly, we're going to switch sides here and I'm going to keep talking. You do the 5 breaths. People ask me what position their head and shoulders should be in, and I don't really care. I'll be honest. You could be up on your elbow. You could be here. You could be here. Whatever is comfortable. But the hip flexors are a very commonly tight and short muscle. That's because when we sit, they shorten. And as a rule, by and large, we all sit probably more than our bodies would like. If we have a job that requires us to sit and work at a computer, well, this, I guarantee you, your hip flexors will be tight and short. That's just par for the course. Sometimes we can't change our occupation. Sometimes we are forced to be in these positions for a long period of time. So there's not much you could do about that, but you can take the time to stretch and try to balance things out. So the muscles in front of the hip are the hip flexors. It's not the muscles on the side. It's not the groin muscles. I see so much misinformation on the internet about hip flexor muscles. And I say that because it's psoas, iliopsoas, and a couple other hip muscles that are falling into this category. But it's for me, it's just easier to say hip flexor muscles. So yeah, when we sit, those muscles shorten. It's wise to consider that. People sometimes say, well, I have a job that doesn't require me to sit, so I should be fine. And I say, hogwash, you were in school for a period of time, and as such, you were required to sit most of the time. And as such, your hip flexors probably shortened then. And you're probably still feeling the effects of it. Okay, now we can move forward to the next one. Straight leg stretch. So this is the other muscle that tightens and shortens. So if you're sitting, hip flexors are shortened. The muscles behind the knee shortened. So we've already stretched the hip flexors by doing that one. Now we're going to stretch the muscles behind the knee. And say, oh, it's a hamstring stretch. No, I don't want to do a hamstring stretch. I want to stretch the muscles behind the knee, partly the hamstrings, but I'm not going to go touch my toes. In fact, find a chair. You could also do this by the stairs if you want a little bit more of a challenge, if a chair doesn't feel like it's doing much. But put the heel on the chair, bring the toe towards you. Hold, and we'll call this one 5 breaths. This one's a little bit more intense for some people than for others. If you're not feeling it, I'm going to ask you to check one thing. Before you do the stretch, make sure both feet are going straight forward towards that chair. Then, with the feet straight forward, put one foot on the chair. If you have to have another chair nearby, or a broomstick or a wall to help for balance, that's fine. When both feet are straight, it's harder to keep your balance. When your bottom foot bends out or twists out like that, it's easier to balance, but now I'm stretching my groin instead of the muscles behind the knee. So let's not do that. Both feet straight forward. We'll switch sides again. Both feet straight forward. Try to think of them as two railroad tracks. Both knees straight. Foot that's on the chair, bring those toes towards you. You'll get an additional stretch in your calf muscles. That's just a bonus. But if you're going to stretch the muscles behind the knee specifically, you do. You have to stretch the hamstrings and the calf muscles. There's no two ways about it. Okay, one more time on each side. 1, 2. Make sure the bottom knee stays straight instead of this. I want this. If you're still not feeling it, you can stick out your butt, stick out your chest. Do that instead of going down to touch your toes. One more time on the other foot. Knee straight, feet straight. Bring the toes towards you. Stick out your butt a little bit, stick out your chest a little bit. Take 5 breaths. We'll call that 2 breaths already. 3, 4, 5. Okay, we're cruising along here. We're also going to use the chair today for a stretch that I've not done with you before. I started bicycling more, and I'm not exactly sure why, but I found that my piriformis muscle really tightened up and shortened up. I like this one. Occasionally, I see it overdone. I see it done a lot. So just have a seat in a chair, cross one leg over the other, and most people at this point would say, oh, there's a little bit of a stretch there. If you don't feel much of a stretch, I want you to try to lean your whole body forward. I don't want you to drop your head down. I want you to shift and lean your chest forward. Stick out your butt again, stick out your chest again. I'd rather you stretch like this than collapsed like this. All right, we'll call that 3 breaths. 4, 5, good. So, I think you could see it on the video there, just so I can get a different angle. Cross your legs. This is like a man would typically cross their legs. I'm going to shift my butt forward a little bit on the chair, and then I'm going to shift my chest forward, my head forward, and try to stick my butt out. Again, I like this stretch a lot better than collapsing and rounding. Try to avoid the rounding. 4, 5. Sometimes if you have sciatic type pain running down the back of the leg, sometimes you can get, that can be due to a tight piriformis muscle. Let's say that a tight piriformis muscle is often seen alongside those sciatic type symptoms. Cause and effect are sometimes kind of tough to feather out, but you can make relationships and causal relationships theorize all you want, but if you see the two together, it's better to think of it as not necessarily, the sciatica pain is entirely due to my tight and short piriformis, and it's piriformis syndrome, which is a common diagnosis. I find it happens, but I don't think it happens nearly as much as it is actually diagnosed, and I think there are other causes of sciatica that need to be looked at. And in fact, just blaming one muscle like the piriformis and saying, aha, it's your piriformis muscle, it doesn't make a lot of sense to me. Yes, it's a classification system, and that's good, and there's it certainly can be up to piriformis, but it's more about finding out why that piriformis muscle is tight and short. And if you can come up with some sort of theory and act on it, that is as helpful or more helpful than any number of exercises that I can come up with or any other therapist can come up with. So it's helpful to take a step back and look at your habits, your positions. My setup on my bicycle probably isn't completely right, but sometimes when you push the limits, things like that come to light. So I just have to be a little bit more careful and diligent about figuring out exactly what position is best for me on my bicycle. Maybe it's a different cause for you. Maybe you don't have piriformis pain or tightness at all. Maybe that one was terribly easy. Okay, moving along. Let's jump up to the upper body. We only have a little bit of time left here. I really like this biceps stretch, shoulder stretch combination. Finding a corner, an edge of a wall is extremely helpful. A doorway works just as well. But make a fist, put this part of the fist on the back side, gently lean forward. Don't lean forward to the point where you're turning beet red and you're holding your breath. If you want to count 5 breaths, please do so. I'm going to keep talking. Just know that this is one of those situations I see a lot of people stretching too hard and going, and they're holding the breath, and I feel like this is entirely pointless. So from the back side, this is what it looks like. So if you feel the tendency to hold your breath, that should be a sign that maybe you're pushing too hard. Back off a little bit. Like I said before, stretching can sometimes be painful. I want you to think about wading into the pool of pain rather than jumping in head first. Jumping in head first will be a shock to your body and your system. Your body will reflexively tighten up and shorten things. Not really a good way to try to relax and stretch. Make sure your shoulder stays down too. This is one I see a lot of people thrusting their shoulder up. I don't know if that's intentional or just some kind of weird reaction, or elevating the shoulder doesn't give you a greater stretch. And switch sides again. Don't worry about the exact placement of your feet. I'm not so concerned about that. I'm more concerned about A, you relaxing into it, B, keeping the shoulder down, and C, gently pushing on it and continuing to breathe. I find that the biceps are one of those muscles that we often forget to stretch. I'm not sure why. But if you think about it, it's one of the muscles that is really shortened because we're oftentimes in this position working, driving. Bicep muscles are shortened. Moving on, grab your strap again And we're going to stretch out the shoulders and triceps. I'm going to wrap, this is a robe belt. I'm going to wrap one end around my hand, drop the other end down my back, and then pull with the opposite hand to the point where the elbow comes up a little bit. This will stretch out the triceps. This will also stretch out your lats a little bit. But I do have to keep a little bit of effort in not letting my head drop down forward like this. Make sure your eyes are going forward, your nose is pointed forward, and not drop down like this, but your eyes are going forward. Make sure your nose is pointed forward. Switch sides. Wrap it around the left hand, drop it down the back. With the right hand, pull it taut. The elbow should stay up, the head should stay upright. Take 5 breaths. My left shoulder is definitely tighter than my right. I could do this stretch all day long and I feel like it would never fully lengthen. This is partly because of my job. I'm constantly pushing down on patients while adjusting them. So it just never gets a chance to fully relax. Maybe on the weekends sometimes. Wrap it around one hand, the right hand. Drop it down. Pull. I'm actually going to get an additional stretch by leaning it up against the wall. If you want to, go right ahead. Still helpful to realize that your head should be going straight forward. If you have to push your hand back or your arm back with your head, go right ahead. Sometimes that little bit of push gives you a little bit extra stretch in your lat muscles. Going back to the left. Pull. You can tell my shoulders are pretty stiff. I'm also going to lean into the wall with this one as well. Two, 3, 4, 5. I think that was only 2. I think we're going to do one more. Right hand, wrap it around, drop the strap down your back, and pull it down. And from this angle, I'm also going to lean into the wall here. So the angle I'm leaning is this way. And yeah, I'm having a hard time keeping my elbow up. Some of you might even have a harder time. You might be in this position. 4, 5. One more time on the other side. Wrap it around the left hand. Drop it down. Pull with the right. If you want to, lean into a wall. 1, 2, 3. Again, don't worry so much about what your feet are doing. It's not really important. If you're leaning a little bit into the wall or the door frame, that's the goal. Okay. One more, we're going to focus on the pecs just a little bit more. Find the door frame, find the corner of the wall. Arm up in the door. You want that forearm to be vertical. You want this part of the arm, the upper arm, to be horizontal. Not here, here. 90 degrees, 90 degrees. Gentle. Again, please, don't push so hard that you're going to automatically hold your breath. Continue to breathe. Make sure the shoulder is relaxed and down and not artificially elevated in any sort of weird way. Pec muscles do get tight. These are your chest muscles, pectoralis, major and minor. I believe this one focuses a little bit more on the major. With that forearm vertical and the upper arm horizontal, you can get just a little bit more of a stretch if you turn your head the opposite way. But then again, like I said, don't push it too hard. I'd rather you make sure that you continue to breathe, because for whatever reason, particularly with these shoulder stretches, these are the ones I see people holding their breath and having a very hard time continuing to breathe. So, again, we're going to go very gentle. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. One more time on each side. 1, 2, 3, 4, 5. Last one. 1, 2, 3, 4, 5. Last stretch of the day. I got just another minute or two. Forearms. Yeah, your forearms can get tight too. It doesn't take a lot to stretch out your forearms, and just keep your elbows straight. Pull the fingertips towards you. Breathing's not as important on this one. I don't see people holding their breath nearly as much. Manual laborers use their forearms quite a lot, twisting a screwdriver. If you use screwdrivers a lot, if you grip a lot, using a shovel or heck, anything with a handle on it like that, your grip has probably been fatigued. Stretching out your muscles in this direction can be extremely helpful. And yes, being on the computer as well. I know we're typically holding our hands in a slightly elevated position, but this is still helpful that in as much as it'll help a lot of those, stretch out a lot of those tendons that run through the carpal tunnel. Yes, tendons are attached to muscles. Muscles become tendons, tendons attach to the bone. So they run through that carpal tunnel, and if they're swollen, they'll swell up enough to pinch the nerve that also runs through there. All right, last one. I know people don't often think about stretching out their feet and hands, but muscles work in systems. And so isolating the hips, the shoulders, yeah, sometimes it's helpful, but also sometimes it's helpful to see what connects to those areas. So the muscles that do this part of the forearm grip also connect to the biceps and into the pec muscles. So you're talking about this type of movement. So we're talking about the fascia that connects one muscle to the next. So that's how they connect. They connect via fascia. So that's why stretching out the quadriceps first is the best way to get to the hip flexors, because there's already tension on that fascia. So a little bit of context for you. I hope you enjoyed today's stretch. I feel pretty good. I feel pretty relaxed. It's going to be probably one of the warmest days you'll get of fall remaining. So get out there today if you're in Grand Rapids and do something fun. Enjoy this weather. Have a good one.